Listeriosis is an illness caused by the bacterium Listeria monocytogenes that is acquired by eating contaminated food. The organism can spread to the bloodstream and central nervous system. During pregnancy, listeriosis often causes miscarriage or stillbirth. This bacteria can be carried by many animals and birds, and it has been found in soil, water, sewage, and animal feed. 5 out of every 100 people carry Listeria monocytogenes in their intestines. Listeriosis is considered a food-borne illness because most people are probably infected after eating food contaminated with Listeria monocytogenes. However, a woman can pass the bacteria to her baby during pregnancy. In addition, there have been a few cases where workers have developed Listeria skin infections by touching infected calves or poultry chickens. Persons at particular risk for listeriosis include the elderly, pregnant women, newborns, and those with a weakened immune system called immunocompromised. Risk is increased when a person suffers from diseases such as AIDS, cancer, kidney disease, diabetes mellitus, or by the use of certain medications. Infection is most common in babies younger than 1 month old and adults over 60 years of age. Pregnant women account for 27% of the cases and immunocompromised persons account for almost 70%. Persons with AIDS are 280 times more likely to get listeriosis than others. As noted, persons become infected with Listeria monocytogenes by eating contaminated food. Listeria has been found on raw vegetables, fish, poultry, raw, unpasteurized milk, fresh meat, processed meat, such as deli meat, hot dogs, and canned meat, and certain soft cheeses. Unlike most other bacteria, Listeria monocytogenes do not stop growing when food is in the refrigerator, its growth is merely slowed. Fortunately, typical cooking temperatures and the pasteurization process do kill this bacteria. Listeria bacteria can pass through the wall of the intestines, and from there they can get into the bloodstream. Once in the bloodstream, Listeria bacteria can be transported anywhere in the body, but are commonly found in the central nervous system, and in pregnant women they are often found in the placenta. Listeria monocytogenes live inside specific white blood cells called macrophages. Inside macrophages, the bacteria can hide from immune responses and become inaccessible to certain antibiotics. Listeria bacteria are capable of multiplying within macrophages, and then may spread to other macrophages. After someone consumes food contaminated with this bacteria, symptoms of infection may appear anywhere from 11 to 70 days later. Most people do not get any noticeable symptoms. Scientists are unsure, but they believe that Listeria monocytogenes can cause upset stomach and intestinal problems just like other foodborne illnesses. Persons with listeriosis may develop flu-like symptoms such as fever, headache, nausea and vomiting, tiredness, and diarrhea. Pregnant women experience a mild, flu-like illness with fever, muscle aches, upset stomach, and intestinal problems. They recover, but the infection can cause miscarriage, premature labor, early rupture of the birth sac, and stillbirth. Unfortunately, half of the newborns infected with listeria will die from the illness. Immunocompromised adults are at risk for a serious infection of the bloodstream and central nervous system, brain and spinal cord. Meningitis occurs in about half of the cases of adult listeriosis. Symptoms of listerial meningitis occur about 4 days after the flu-like symptoms and include fever, personality change, incoordinated muscle movement, tremors, muscle contractions, seizures, and slipping in and out of consciousness. The overall death rate for listeriosis is 26%. This high death rate is due to the serious illness suffered by newborns, the elderly, and immunocompromised persons. Healthy adults and older children have a low death rate. Complications of listeria infection include meningitis, sepsis, miscarriage, stillbirth, pneumonia, shock, endocarditis, abscess, localized infection, formation, and eye inflammation.